Hello. Today I'll talk about OCDs. What are OCDs? OCDs are ritualized, irrational, and uncontrolled thoughts and behaviors that the individuals can't resist them and can't get out of them. In this pathology, there are two entities, obsessions and compulsions. Obsessions are involuntary, they hinder, they paralyze. Compulsions are actions and behaviors that the patient feels compelled to accomplish them to get rid of obsessions. I'll talk about two obsessions. The first one is about people who are afraid of contaminations, dirt, germ, bacteria, fungi, parasites, viruses, and also they are afraid of suffering from serious diseases, cancer. They have compulsion of washing a lot, cleaning a lot. The other one is about the people who are superstitious. These people think that something terrible would happen to them if something is not done perfectly. And also they are afraid of having odious thoughts about sexuality and religions. They have compulsion of endless rituals like walking on some walk sites or moving in a specific way before commencing something or touching objects repeatedly. The origin of OCDs is physiological. It is dysfunctioning in neuromediators, which are substances between neurons and allow nerve impulses from idea to action. Among others, three neuromediators are studied: dopamine, sertraline, and vasopressin. Cognitive and behavioral therapy is the most efficient therapy for this pathology. Antidepressants could be given to the patient, but medication alone is not enough to get rid of obsessions. Cognitive and behavioral therapy helps the patient to live progressively without his useless rituals. The evolution of OCD could be serious if a treatment is not done, but of course it depends on its intensity. Thank you so much for watching my videos on YouTube. I will come back to you with other subjects about psychology. Bye for now.